Hi, everybody. We want to welcome you in on this Monday. This is Coronavirus Inside the Arizona Numbers, where we take a deeper dive into the numbers here inside of our state and get all your questions answered as it pertains to the data coming out on coronavirus here in Arizona. A lot to get to. I'm back at the station on a Monday, Garrett. We have Monday Night Football tonight, so a few more faces masked around here, but a little still pretty empty, as you can see behind me. But thanks for joining us. Get your questions and comments entered in the chat, and we'll get to them. Garrett, we start where we always do at that summary page. I know a lot of people were watching the numbers closely because here in the U.S., we're getting close to hitting 200,000 lives lost. We have not gotten to that sad marker just yet, but we are very close. We're also very close to 7 million cases here in the U.S. So when we look at Arizona's numbers, how do things look?
Well, today, as is typically on Mondays, we don't see a lot of cases or deaths added to our system on Mondays. So, and today was no different. 233 new cases added today, with only two new deaths. And in the case of both of these numbers, they are both very recent. So these two deaths were reported in the last, they're from the last 2 weeks. And these 233 cases are also from the last 2 weeks. So just there was no backfilling today. This was off of 7,000 tests. The percent positives for these was, we had a good percent positive today. Everything was well under 5%. In fact, we're getting closer to under 4% now. So that's where we are. Things are looking still pretty good with our just basic summary number additions. I know we had some increases over the last couple weeks that appear to be explainable by the universities. But so far, we haven't seen too much indicators that that's sort of spread outside the university bubbles at this point.
Okay, so do we believe that they are done with that mass antigen testing
Yes,
results that came in?
it does appear that they are done doing just a mass antigen ad that like we saw last week. We will obviously still get antigen tests in, but these antigen tests will come in as they're being done now instead of being backfilled from the last 6 weeks or 8 weeks or something.
Okay, I see there's a lot of conversation about me not wearing a mask. So let me clear this up really quickly. When we're inside the television station, there is a very small number of people in the TV station, and everyone is masked. And when we go on air, we take our mask off so that our viewers can see us on TV. That's why you do not see anchors with a mask on TV here in the station, because they limit the numbers to keep us safe. That's how we do that. We're allowed to take a mask off at our desk. We're allowed to take the mask off at the set. If I got up right now and walked around the station, I would be putting my mask back on, just as you'll see anybody who might be walking by will have theirs on. So I definitely want to clear that up for folks. That is how we have handled this throughout the pandemic, and we are considered essential employees, and we have worked straight through this to bring you coverage. So we did not take any time off. We were not, we were essential workers since it began. We even had to carry papers in our car so that if we got pulled over, we could explain to local authorities why we were outside of our homes at that point. So when there was a curfew, go ahead.
And I'm in my home / kids playroom. So
yes. So no mask there. No mask there. So I wanted to just clear that up really quickly. And then some of the questions that, oh, thank you. Elizabeth's writing, you don't have to explain to anyone. I just want everyone to know that I'm taking the most safety precautions for myself and for my family as well. So wanted to clear that up. All right. Some of the other things we need to get to, I did note one number on this summary page, Garrett, that our county here in Maricopa County, our most populous county, did pass that 140,000 mark overnight.
Yes.
So just a number of note right there. How are things looking? Wasn't it Santa Cruz that was declared basically COVID free?
No, it was Greenlee County.
Greenlee, thank you.
Greenlee still does not have any active cases. As you can see, their numbers are still all zeros. They're not even testing right now. In fact, they haven't been testing really for about a week now. And really, they test when things come in for a reason to test, and there hasn't been a reason to test yet in Greenlee. So yeah, they're still running at zero.
Yeah, so some great news there. All right, some of the backfill. How are we in any lagging in test reporting, and how is it looking for things that are being backfilled at this point?
Let me pull that up. I did not see any lags today. I'll stop sharing this and I'll bring in my report as soon as it renders, and I'll just show you the different charts that I use. I show them at least once or twice a week, so it should be ready in just a second. Here it comes.
And as you're pulling that up, I just want to remind folks the Roll Up Your Sleeve campaign has started here in Arizona. That is the campaign asking you to go get a flu shot so that we don't overwhelm our hospitals with both flu season and this continued coronavirus pandemic that we are in the middle of, that we don't have another surge and really stress out our hospital workers through all of this, because those two things could be colliding at the very same time. That campaign, again, rolling out now, called Roll Up Your Sleeve, asking you to get a flu shot.
And so here we are. I've got my sheet that I give actually this to the newsroom. So this is, you guys are all seeing what I give to the newsroom on a daily basis. This is the curve and what it looks like today. It's very hard to see any light blue because there's simply very little light blue in this whole graph, except for at the very, very front. This is the case epi curve. And you can see right here, this is what I'm talking about. Of those 280 cases or so, they were all added right here. There were a couple withdrawals from duplicates and everything, but really all the tests or all the positive cases came in the last couple weeks. And then here's the tests. Same exact thing. Almost all the tests were done now. There was a little bit of backfilling of tests, which is why we had a really good % positive for the COVID tracking number today. And you can see that right here. There's about 1,800 tests that were backfilled from June to about mid-July. Aside from that, every other test came where we expected, which is right there. And then the deaths, as I said before, the deaths were both added in the last 2 weeks. They're right there.
Okay. And as far as our hospitalization numbers go as well, obviously we get those pretty quick. I wanted to walk through some of those too. You do a great job of letting us know each morning on your Twitter page how things are sort of looking, but any cause for concern in any of those numbers?
No real cause for concern, although this is the emergency room graph, just the one that I produce that has an average on it. And you can see, this is what I was talking about when, because I again, if Brant's on already, or if he's on,
He is.
the word
Hi,
noise.
Brant.
Hi, Brant, how are you doing? But this sort of cuts through a little bit of the noise because it's a 3-day averaged graph. And you can see there is a sort of a sustained upwards movement in the emergency room department numbers right now. Very, very slight, but it's still sustained. So we're watching this to see what happens. Obviously, it's not as big as what we see, these sort of leaps and valleys here. But we'll just have to continue watching. And then here's the ICU numbers with the ventilator numbers. And you can see we're at record lows for all of those numbers and continue to be so. We haven't seen any sort of change direction in ICU. And then inpatient, similar situation. No, we did see a slight bump last week, but again, the direction is still going down, and we hit that record again today. And then these are sort of the graphs that look the same as the ones that are on the AZDHS page, showing about 36% of emergency room visits are still coming from COVID-19 patients. This is an interesting one. I asked the AZDHS as to why the cap of the total census numbers has dropped, and it's dropped, at a level. It's remained for 4 days at this level cap, and they simply couldn't give me an answer yet. It appears that some hospital system decommissioned some beds or did something, and they dropped the level cap for the inpatient beds, but it hasn't affected the census numbers at all. And then ICU numbers, again, what we were talking about, record lows with ICU. So those are all of sort of the hospitalization numbers we're at. Everything is still very good on the hospitalization front. Nothing to sort of indicate that we are, going to have any sort of even rise in hospitalizations quite yet. The CLI number that the AZDHS puts out, let me see if I can get to that really quick, because they recalculated that today. I will share that screen. And there we go. And this is recalculated every Sunday. That's the hospital and COVID influenza-like surveillance system. It's done on a weekly basis. And you can see the inpatient number has continued to drop. It's at 2.3, which is a little higher than it was. It looks like it's in the same place essentially it was last week as far as levels. It's where we were in around early March. And then the emergency room numbers, though, you can see 1.6% of emergency room numbers. So, and that's lower than we've ever recorded for these COVID-like illness surveillances. So this is just, we're waiting for, in order to see if there's something going to increase, it's going to come from either this graph or those hospitalization graphs, especially the emergency, and we haven't seen it yet. So all decent signs at this point.
Yeah, really good signs. So we did have some kids going back to school today, a couple different school districts inviting a handful of grades back. If you're curious what it looks like in your neighborhood, or if you want to check on your kids' school or grandkids' school, you can do that right now on abc15.com. We've got an easy to use graph and map on there that shows you when the school district in your neighborhood is heading back and when the school is headed back. That is abc15.com/schools. So you can check there. Our education reporter, Danielle Lerner, is updating that thing all the time. Round the clock, she is dedicated to this information. So that's where you can find it. Or if you're curious, maybe what a nearby school district looks like compared to your own, that's the place that you can find it. Let's see. One of the things of interest that we were tracking, Garrett, over these past few days has been the Tempe wastewater situation. We reported on that early on. And for folks that don't know, they were testing the wastewater to try to find out how prevalent COVID is in that area. One of the more interesting ways to kind of get a handle on things and see what's going on in this. So, how have things changed in that? They are still tracking things that way. And what early signs? This is one of the ways. Was it U of A that caught some numbers early
Yes,
and said,
U of A
"Wait"?
caught this very early and put it out, and
And they tested
really used
everybody.
it to, yeah, they really used it to kind of keep their infection rates contained. So hold on a second. Sorry, I'm going through this.
That's
I'm in
okay.
September, thinking I'm in August. So let me put this in right here. Here we go. So this is what this is. This is the Tempe wastewater dashboard. And I'm going to start. I'm going to make this as easy as possible to read starting out, and then I'll go through them one at a time. So we're going to start with. Let me get rid of that right there. We're going to start with area collection 6, which if you look over here on the left-hand side, this is this small area. I'll try to bring it in a little bit so you can see it's near ASU, and it's over by Apache, and it's this area right here. And this area has had some pretty interesting numbers show up in the last couple of weeks. This 9/7 to 9/13 specifically, 3.9 million copies per liter of the COVID-19 genome. I'm going to bring us back to July, or let me bring this back to June really quick to just show what this means. And I'm going to pull these out so that you can only focus on that level 6 area. And why this is significant is because here we are at the very peak of the pandemic, and it was at 1.6 million copies per liter. And here we are at 3.9 million only a couple weeks ago. So definitely there was a clustering of COVID-19 cases that were in this area 6. And this is extremely obvious just by looking at this. So now I'm going to I'll just go through all the levels here. You can see we've had increases pretty much everywhere. Here's area 7, which is, this is the sort of, again, ASU, a little bit of Mill Avenue as well, and the areas surrounding Mill Avenue. And you can see not quite the numbers here. This one was at, actually it is a little bit higher, 666,000 copies per liter on June 22nd to June 28th. And just this last week, 973,000. Nowhere near what Area 6 was, but still a considerable jump and also higher than they were at their peak. Some of these didn't have any increases or very meaningful increases. Like here, Area 5, for example, which is down up here, on the north end. There's been no real quantifiable, there's been a couple hiccups here and there, but nothing of any real concern. Here's Area 4. Again, some pretty large jumps, but still only within the, it's at 381,000 copies per liter. It's a significant amount to be sure, but nowhere near that 3 million. This is an exponential graph, by the way. So just so that we know what we're talking about. This area 3, which is down here, has nothing. It has no quantifiable traces at all. It never has.
Very interesting for people maybe who have been asking us about elementary schools in the Tempe area who were concerned that they couldn't get accurate information because ASU's numbers were changing their overall numbers so much that they couldn't get a good handle on how things look for their own kids. So this is the Tempe city site, correct?
Yeah, this is a wastewater collection for the genomes I see someone saying false positives, but this is not a case where there can be false positives because they're literally looking for the genome
in the urine.
of the wastewater. So this isn't a false positive situation. It's impossible. But here's Area 2, which is up here on the east side of Tempe. pretty large portion of Tempe, but again, pretty. I mean, here we are at, it was at 1.2 million at the peak, and now it's at about 754,000. Definitely, noticeable, but certainly not where it was. And then, of course, one which is the rest of Tempe. I mean, look at this massive area. One is such a large area, and still only about 145,000 copies per liter in that entire area. So you can see just by looking at this dashboard that the large portion of this is coming from right here, Area 6 and Area 7.
So this is fascinating because this is the same thing that we saw at U of A. When it's in the wastewater, you're not necessarily having symptoms yet. If you have symptoms at all in this case, these are young people who might not be paying as much attention to it, or are busy with their lives and not even, noticing that cough so much, so to speak. But this is a concern because you could be in a situation where you're spreading it to so many other people because you don't know that you're sick just yet. So this is a fascinating tool. If you guys want to hop on and look at it, we'll make sure you know how to find that easily, and a great resource for those who live in Tempe who have been disappointed that they couldn't find more information based on the ASU numbers sort of clouding things up.
It's definitely, and it's on both sides of the distribution curve. So it's definitely, it catches it early, but it also catches it very late too, because the virus sheds into the wastewater and long after the infectious period. So that's just something to sort of consider as well. This is this is a good, this isn't going to tell you anything. I'm not going to ever use this as a canary in the coal mine type expression, but it's a good indicator, at least in Tempe, of like what we've been talking about with those, like you said, the kids in the elementary schools. As the farther you get away from ASU, the trace amounts are just, it's getting to the point where there's nothing, in that area. So I mean, it shows that these clusters that were increasing in that area were pretty much coming from the area around ASU.
Right around ASU. Okay, so just another tool. This is Tempe the only city here in the valley that gives us this closer look at the wastewater?
Yeah, so the only ones that are giving us this data. Guadalupe is using this data, and there may be some other cities that are using this data, but Tempe is the only one that gives us this data to my knowledge.
Yes. Hey, Cindy, we're on the same wavelength. Cindy just wrote the exact same question at the exact same time. Glad we could get that answered for you, Cindy. We're sharing a brain today, you and I. All right, let's move on to some of the other items on here as well. Since we were just talking about ASU and how ASU is doing this and U of A is doing this. I haven't heard that NAU is doing this, but we can tell you the numbers out of NAU right now sit at 273. ASU will give us an update on their numbers this evening. They do that on Monday nights and Thursday nights. Garrett, do we know how things look for U of A?
U of A, I'm looking at the dashboard right now, and I'll share it because they, by far, of the three colleges, they have the best dashboard. Well, they have the only dashboard, so they automatically get the best dashboard. So here's the COVID-19 testing results, and this is updated nightly. Although it does appear they do not update it on the weekends because it was last updated on September 18th. So we'll be waiting for an update this evening to see what happens here. But you can see we're looking at, as far as their percent positives, they did experience a pretty significant decrease from the last couple of days. On 9/16, they had a 17.5. Now they're to a 6.1%. So we'll see when they do their weekend update. It's going to be very interesting to see if that percent positive holds, or what direction it goes, because that's going to tell us a lot of what's happening over down there in U of A.
Yeah, for sure. And for those of you who hadn't heard, back to ASU, they will be ending classes after Thanksgiving. So they'll be telling folks to head home at that point and switching up some of the tests and finals. Forgetting the word, I've been gone so long. The final schedule over at ASU. So you want to check on that if you do have friends or family going there. When we see some of these numbers, Garrett, coming in, we have 1.6 million test results in so far here in Arizona. Are we able to tell how many of those are from the antigen tests? Or when we see 1.6 million total, where can we find a breakout, or can we, that some are antibody and that some are the PCR? How are they splitting those up now that we've added the antigen into that?
So, very interesting question. I don't have a way to do a breakout of the antigen test, but I can tell you how to find the cases that are coming from antigen tests. and that's actually on the dashboard. I've already have it shared, and it's actually quite simple. You just hover over the number of cases, and then you see this number probable, which right now is at 4,335, about 2% of the cases. Those are the antigen cases. On September 16th, when the AZDHS changed its case definition guidelines, one of the things it did is it removed sort of this serology, but there was a method for them to basically do a serology positive and call it a probable if a certain it was either a protein or something. Please, forgive me that I'm not in medical science, but they were able to show a small amount of probables based on a certain result in those serology tests. But they've removed those, and this is now probables only based on antigens. So it's this 4,335 cases that are coming from antigens.
Okay. Let's see. Ken is asking about who pays for the tests. Do the universities pay for these tests? If you go get one of these tests, it is free. If you go get one of the saliva tests from ASU, you do not pay when you go. So if you're interested in getting one of those, you can sign up on the AZ Department of Health site. At last check, they were having 2 per week, but I know when the demand went down, they were considering changing that. So you'll want to check. It used to be on Tuesday or Wednesday and on Saturday morning. So go on to AZDHS and then you can scroll down, choose the saliva test. That will be a free test, and that is the one done through ASU. Let's see. Somebody else had just asked a question I want to get to. Christoph asked, what's the population for Arizona? It is about 7 million. 4.4 million live here in Maricopa County, just for reference. So we have more than half of Arizonans here within our most populous county. That's why we spend so much time on Maricopa. Kathy Webb asks, is our R naught number below 1 yet? It is back below 1. It is at 0.99 today. Barely, Kathy, barely. We're just in there, just in the nick of time, right? 0.99 is where we are today. Garrett, we were warning folks to be cautious of this number because adding all those antigen tests in, we're going to make that fluctuate a lot and not really be as reliable unless you're checking it every single day like we do here. Do you believe that has leveled out a bit, or is it a number not to pay attention to too much this week until it can sort of stabilize?
I think that it does appear that whatever statistical methods they used to smooth this out and make sure it didn't jump too wildly were proper, because we didn't see a massive jump over the last couple of days from the weekend from last week's antigen ads. So 0.99, I mean, that's essentially is where we were last week. We were at 1.05 or something. So we've been hovering in this one, just anywhere just above 1, under 1 for about a week and a half now, which really is bared out. I don't even know if that's a word. My apologies. It shows itself in the test numbers that we have, and how even the epi curve looks. The epi curve is sort of evened out right now. It's very level. So it's actually an appropriate number for us right now. Is that 1?
Yeah. Flora writes that she lost a very good friend this week. And Flora, I'm so sorry for your loss. First, she commented on that a little bit ago. And I don't know if your friend was here in Arizona. Yeah, here's her comment, Flora. This isn't fake at all. We just lost a really good friend to COVID. Flora, I don't know if your friend is here in Arizona or in Maricopa County, if they're reflected in the 5,500 numbers that we do have now here in Arizona. But either way, so sorry for your loss. I know that more than 200,000 Americans are going through this right now. And we interviewed a family last night who had lost a half dozen people just within their own family. So some people are disproportionately, sadly, aware of how deadly this can be, and how sad it would be to lose someone in the middle of this when you can't even have a proper goodbye as well. So Flora, thanks for sharing. And we hope that you have some time to pause and remember your friend. Anthony is asking about the active cases right now. We can answer that for you, Anthony. I did not see that in your update today, but I know you always track that for us, Garrett. How do things look?
Today's active cases, everything's sort of increased just a little bit, but our active cases seem to be about 11.6 to about 18.6 thousand. So little under 12,000, a little under 19,000 is the estimate of where our active cases are.
The active range. And of course, we always mention you get that by taking the 214,000 cases here in Arizona since the pandemic began, sadly subtracting the deaths out, and then subtracting any cases that were positive based on their date. So if they've gone over 28 days.
Yeah, they have to be within either 14 days for the low estimate or 28 days for the high estimate, because really that's the active period of this virus. You know, when they
Yeah.
backfill a case, and, you know, especially when we had those antigens coming in and they were backfilling, you know, 1,300 cases or whatever that were from June or July, like those are obviously not active cases, no matter what was the situation with those cases or what the outcome was, because they're no longer active if they're from, you know, 6 weeks ago.
Right. Yeah. Most likely, not too many would be the long haulers who are hanging out, still fighting that. Amanda's asking, can you put the link up in the comments for us to check out our school districts? Amanda, we can. I think also, Amanda, I believe you wrote thank you for us for doing this each day a little bit ago, and I did see your comment. And I want to say you're so welcome. That's why we do this all the time, just to provide the best information so that you all can make the best decisions. Garrett and I are both parents of littles here in Arizona, and we always have choices to make to keep our kids safe too. So we just want to let everybody know where they can find this data, where they can find the information, so that they can make the best choices. And for the school districts, I believe you want to check out the school's dashboard, and that is on maricopa.gov/school dashboard. And remember, Amanda, that's updated on Thursday night. So if you've checked that since Thursday night, it's not going to change until this coming Thursday, but that's where you can find it. And then also, as I tell everybody, be sure to check your zip code, your high school district, and then your elementary district as well, because the way that things are shaped within there can mean some different numbers and different test results. I always use my own example. My zip code goes one direction, my school district goes another direction, so I get two entirely different numbers, and it seems only about 10 houses overlap within those two areas. So I just want you to be sure to check all of those so that you can make the best choice for your family. All right, Amanda writes, thank you. You're so welcome. Let's see. Micah's asking, are the antigen tests being added? Oh, so many comments are going in fast. They're moving past. Here we go. Are the antigen tests being added into the zip code summary on the ADHS website? I didn't notice any jump over the last week. So that would just be within the Tempe area.
That's the AZDHS zip code summary for the AZDH website. That's actually a great question. I don't know the answer to that. I don't know if it's translating to the zip codes. So I'm gonna have to find out.
Because the map that he's talking of is the map that's specifically on the AZDHS site that's got the range of like 0 to 10, 10 to, well, now the ranges are huge, you know, based on what they were before. They were much smaller, but now like 1 to 1,000, 1,000 to 2,000 or whatever. And it was red, orange, and white, that map that sort of gave us a color-coded look.
Yes. Well, let me go to that map. I do have some numbers on that, and so I'll just go to not the I'll go to the AZDHS map, not the
Okay.
The Maricopa map, because it only updates as you said, every Thursday. So it's just, since it's Monday, there's not really much to look at right now.
Mm-hmm.
But if we go to the zip code map, I'll just go through some of the zip codes that you know, we've had some tremendous growth in. The zip code that has had the most growth over the last week, by far and away, is this one right. No, hold on, 850. Where are you? 85009. Hold on. Here it is. Sorry about that. 85009 right here. This is added 1,400 cases in the last week.
Do we have any idea what's going on there?
Yeah, this is the Lower Buckeye jail complex right here.
So some of the testing came in, and that's what has swayed those numbers.
This entire area right here, it's hard to see with the layers, but I'll see if I can pull this off really quick. That did not work. That was completely not worth it. But yeah, that little area that I was pointing to, that's the correctional facilities, and it appears that they did do a lot of testing of the correctional facilities over the last couple of days. The next zip code that had the highest number of growth was 9, which is right here in Tucson, University of Arizona. So 85719 added 1,400 cases over the last week.
Okay,
so this one right here, it's gone to 2,488. It was at 1,088, and now it's at 2,488. So that's something to consider as well.
We also saw some pops that were a little bit concerning on the reservation last week when we were looking at, I believe it was like Salt River, Pima area, that we were seeing some of those numbers that were disproportionately high to the rest of the valley.
Yes, we were looking at the GIS number, or the Maricopa GIS site with those numbers, and we did see. Sorry, that's not the right one. This right here, 85256. It is as far as the number of cases, the case count of being only 382 is not disproportionate to many of the zip codes around it. However, this is a very sparsely populated district, a zip code that's in the tribal, the Salt River Pima tribal reservation, and that number 382. I mean, they're adding cases that are at taking their per capita number, and they're getting triple digit per capitas right now, which is fairly concerning for such a small and lightly populated area.
Yeah, we'll keep tracking that to be sure. One of the other things to update you all on, knowing the difference between the symptoms from the smoke that some of us have been breathing in from the West Coast, from California, that's been blowing over here, and COVID-like symptoms. So some of the symptoms, like a dry cough and a sore throat and difficulty breathing, those can be caused by both wildfires and also smoke exposure. So they're just wanting everybody to make sure you understand the difference between whether you're experiencing smoke exposure or COVID-19 symptoms, and they have the symptom trackers that you can check as well. Symptoms like fever or chills, muscle or body aches, or diarrhea are not related to smoke exposure. So one of the things just to make of note, I know a lot of people watch from California, but also some of the smoke that's been blowing in here to Arizona as well. If you want to look up a self checker, a symptom self checker, we can put one of those in the comments as well. I can leave that for you there, but it's something to note, especially when all of us are breathing in kind of gross air here in Arizona. All right, we reminded folks that the zip code map will be updated on Thursday. Are there any other things of note with the zip codes? I know you have some people that you talk to on Twitter that are providing some other graphs and some other ways to look at things. Were any of those updated today that we should check out?
Let me see 1 second. Now that you asked that, I'm going back to see. I think there was one, and I'm like, what was it? See, sorry about that. I know
That's
I'm
okay.
getting quiet. I
And
know I'm not supposed to do that.
no, that's okay. That is just fine. And Nick's asking about the cycle threshold of the test. I don't know anything more about that. I'm obviously not a doctor, and Garrett's a data person. Have you seen anything on that?
No, we've asked about
Yeah.
the cycle thresholds. The ACDHS doesn't keep records on cycle thresholds for the laboratories, and of the reason I haven't done any sort of data on it is that of the epidemiologists that I've talked to about the cycle threshold is it's the way that it's being talked about in the media. May not be entirely accurate as to what is actually going on. We're sort of thinking that it's a very simple formula of spin the CT up, and you obviously get it's easier to amplify and find traces of the virus from a month or two back, and it seems to me that there's a little bit more complexity to that. So, but it's not necessarily, the correlation is not necessarily wrong. It's just that it's more complex than just 40. A cycle threshold of 40 is always going to pick up a virus from a month ago or something. So
Hmm.
that's sort of what that narrative is about. As I said, the AZDHS does not know what the cycle thresholds are for the PCR tests. They just simply said that we don't record that information. It's from the labs. It's the lab's information, and they just give us the data that comes through.
Yeah. Good. Thank you. Alex, oh, you're so welcome. What a nice comment. Alex writes, Katie and Garrett have been the real MVPs through this COVID nightmare. Thank you for all that you do. Alex, thanks for saying so. Really, really appreciate that. All right. Let's see. Garrett, you were just pulling up a graph or some projections from a person on Twitter that you work with
Yes.
quite often.
It was about students avoiding health checks. He sent me a graph on students that are avoiding health checks, and I just thought it was very interesting. I'm trying to,
Like
on the
they're
fly.
not going to the doctor because of
Yes.
COVID, and it's not because they feel
Yeah.
sick. They're just worried or whatever to go to the doctor.
Yeah, so this is basically this. I put up an image that comes from a health check and Mayo Clinic and ASU MedTech Accelerator, and it's just saying number of students check-ins cleared for on-campus and not cleared. It's a little difficult to see this, but it seems it's about 60,000, and the number of employees checked in about 60 or about 13,000 cleared and not cleared, and then right here is our rate of non-clearance, and we're right here down at this. 0.3% and 0.1% for the employees and the student workers.
Hmm.
So I'm trying to get a little more information. I'll try to get something for you tomorrow on this that has a little bit more. I haven't had time to really digest this information quite yet.
Yeah, interesting. So when we saw these numbers over the weekend, were there any surprises as you are so great at putting all of our numbers together, even on your days off? I was able to check it briefly, and it was kind of as expected, with the Saturday numbers still being a little higher, Sunday being a little lower. Of course, today being a pretty typical Monday, if you will. Were there any things that caught your eye over the weekend?
No. This weekend, nothing sort of caught my eye. I'm just looking really quick one more time. I said pretty generic numbers this weekend. Nothing over 1,000 from Saturday and Sunday right now, and also the death numbers were quite low as well. So no, I mean everything sort of was as far as the hospitalizations. All of our indicators were okay this weekend. Especially on weekends because of the reporting issues. I do tend to just ignore the case numbers a little bit more than sort of those, as we've talked about, the emergency room department visits and some of these others that are not. They don't succumb to weekend reporting issues because they're done by the hospitals on a regular basis. And we didn't really see anything this weekend that would cause alarm. So
Barbara was asking, did you post the self-check link? Is that a public graph?
I'm looking for that. So
Okay,
I will try to get that for you
tomorrow.
tomorrow, Barbara. I looked at it, I popped it up, but I don't know where to find it yet. So let me find it. There was
Okay,
an image. I will see if I can find a link to it.
that's perfect. As we have a little extra time on Mondays, we like to see some of these projections and how things look going forward, as far as coronavirus, both here in the U.S. and here in Arizona. We have time to go to a couple of those sites to sort of see how things look over the next couple of months.
Yes, let me pull them up because I thought I had it up. For some reason I don't. So I do apologize.
That's okay.
I'll start with the one that I normally go to. This is the machine learning site. Uh, just this one, as I've said before, this one,
Mhm.
there's less variables to mess with, though it is my favorite one. Here we are. This one has us basically still. It's got a slight increase in our rate of transmission, which we have seen, but it's still sort of showing. Let's see. Actually, it does see it's actually showing a bending curve at this point. Which this is the first time I've seen this model show a bending curve. It's a very slightly bending curve, but it does increase a little bit from where it is newly infected at 3,173 today, projecting out on November 1st that our newly infected would be 3,900. So this is the first time I've seen a bend, an uptick in that metric in this graph, basically since this entire time. This was always here. We always expected this, but I haven't seen this small bend right here. The current infected, this is that number, that 11 to 18,000, but this is also including people that haven't gotten tested yet. And this one assumes that about 10,000. So basically where I have, and then 127,000 at the upper range could be infected currently walking around, but it really thinks at about 51,000. And then right here, this is the total infected in all of Arizona right now. It thinks about 1.7 million people have been infected.
Yeah, a wild number, 1.7 million, yet we have 214 confirmed cases.
Yeah.
It's
Yeah,
it,
it's
it's
pretty incredible, but it just
yeah,
really shows that the level of people that are walking around asymptomatic or just have very very low symptoms. I mean, we've already talked about how the especially at ASU and the younger people, they don't really get symptoms that would be trigger someone to go to a doctor's office most of the time. So
right.
if they're not really concerned about it, there's a good chance that they don't go and get tested.
Yeah. And then this graph only takes us out a month or so. It has not been updated to take us to January as some
Yeah,
of the
I'll go
other
to
graphs have done.
IHME for that. That is the one that does take us out a little farther.
Yeah.
And this one, like I said before, this is the University of Washington model. It's to me, this model has had its ups and downs. It's gotten much better over the last several months. Early
Mhm.
on, this model was way too volatile for me to like.
To feel
Because
comfortable with
we
it.
have our hospitalizations shooting through the roof in a matter of days, and it was like, no, that's not going to happen. We just have nothing that shows that that's going to happen that way. So, but now everything sort of shows. All the movement is now a little more reasonable on this graph. So here we are. This is the projected deaths. As you can see, it goes out to January 1st, projecting anywhere from, it looks like at the top end, about 9,500, anywhere from about, I'll use the upper ranges, 13,800 at the upper range to about 5,900 at the lower range. And that's using all the different masking and distancing policies that IHMEI tries to take into account. And this is, again, the daily deaths. It shows that with certain easings, the daily deaths could start to increase. But if we don't ease those mandates, this model presumes that we would not see an increase in deaths. I mean, a small increase, but it wouldn't be. It would be a sort of a rolling increase. It would be about to where we are right now. And then daily infections. Again, this one's the same with the masks and the easings. It shows that it presumes that if mandates ease, that about, in January we could be up to 73,000 people being infected a day. But it does at the low end believe that's at about 3,700 if things stay the way they are.
And none of these are figuring in flu into any of this at this point.
No, I believe this one does assume a flu seasonal effect. It doesn't actually put in flu numbers, but it presumes that there's going to be some sort of seasonality because of the flu season and the temperature changing. Now that could be that's obviously completely different for Arizona than it is for other places.
Right.
I mean, in some places in the country, flu season also coincides with it being negative 50 outside.
Right.
So there's not a lot of people stay indoors, where we have the opposite effect. People stay indoors in the summertime for the most part out here. So that's just something to take into consideration.
Yeah, hence why we could possibly see more people coming here who are not our typical snowbirds, but who are people who are still working full time, who are not retired, but are choosing to leave the colder city where they are to try to stay in here in Arizona. All right,
we're gonna. This is something to point out, because I haven't seen this in a while either. Is that it says that on December 23rd, 2020, at the upper end of the range, which of course, if you don't, there's a likelihood issue with that. It might not be that likely, but on the upper end of the range, this does have us going over our bed capacity again back in late December. So that's just something to consider, that with all of these metrics that they're using, they say, well, there now is at least some sort of chance that Arizona could go above their hospital bed capacity again. But it looks like it's a very slight chance.
Yeah, just another reason to take care of yourself as we head into this holiday season. A family out there going through loss through a pandemic, obviously is sad and heartbreaking. But to go through a loss in a pandemic and then have it happen over the holidays is even more heartbreaking. So take care of yourselves out there. We're going to wrap it here today. We've got some breaking news coming to the ABC 15 newsroom, so I want to just update you on that. Let you know where you can go to find out more information about both of these topics. First of all, about coronavirus, the latest info is at abc15.com/coronavirus. And then we do have breaking news coming in that the DPS trooper in the Dion Johnson case will not be charged. That update just coming down moments ago. We're going to let you hop on over to another live stream that's going on here on ABC 15, or we'll have updates for you on our newscast this evening. I want to mention our newscasts are slightly changed because of the NFL here and Monday Night Football on ABC 15. So we'll have a newscast for you from 4 to 5, where we'll have even more on that update. And then after the NFL wraps up, we'll be back on. We'll also have news on CW at 61, and then our regular newscast at 10 p.m. So you can find that information on the Dion Johnson case on our website as well at abc15.com. And then to continue the conversation on coronavirus, you can find me at Katie Raml on Twitter, and Garrett on Twitter at Garrett underscore Archer. Let's call it under Archer. Garrett underscore Archer on Twitter. And then if you prefer, so many of you are watching here on Facebook, you can catch me on Facebook at facebook.com/news from Katie. Again, that breaking news just coming in that the DPS trooper in the Dion Johnson case will not be charged. We'll have both of those stories, coronavirus and the Dion Johnson story, for you tonight in our evening newscast. In the meantime, be safe out there, everybody. More coronavirus data updates for you coming tomorrow at the same time, same place. Be safe.